Hello, good evening, good afternoon, good night, good morning to wherever, which part of the world you're watching me. So, today's topic, this is the third webinar we are doing today on behalf of Woodpecker Gwilin. And today's topic is laser for day-to-day dental practice, or I will call it integration dental laser for day-to-day dental practice. Something about me, those who have joined me for the first time. I have graduated from COTS Manipal, Karnataka, which is College of Dental Surgery Manipal, which is in Karnataka. And then after that, I went on to pursue my master's from JSS Dental College, Mysore, Karnataka. After that, in the year 2008-9, I started getting interested in dental lasers. And I did a diploma course in Sharjah, Saltar, that was University of Sharjah. And then I did master's in laser dentistry from SOLA, University of Vienna, Austria. I also did advanced proficiency in dental laser from Academy of Laser Dentistry USA, and we were the part of affiliate Laser Dental uh, LD India. We were the part of the beginning. From the beginning of the part, or we were the, you can say, we were the people who behind starting the Academy of Laser Dentistry India. So this is something about me. I did teaching for almost 19 years, and now I'm running 3 private practices in Lucknow. I have a clinic in all 3 clinics are based in Lucknow. A little bit pics and glimpse of my clinics uh, where we work right now. This is my second clinic, and this is my third clinic. And also, like I just wanted to tell, like we like working with all the modern gadgets and tools, and which makes dentist life easy as well as which makes life of patient also easy. So almost all of my clinics are equipped with magnification, microscope, and lasers. I have got hard tissue laser, I've got Nd:YAG, I've got diode laser, different wavelength of diode lasers also. And disclosure before this webinar starts, few of the pictures I have used here and videos are given to me by my colleague and people who are working with the laser all around the world. So I will be sharing their picture also, just to make videos also, just to make this webinar more interesting. So uh, we had a long weekend, and people who are from India, they can correlate. We had a Holi celebration. So some pictures I'm posting. We played Holi two days back, and because of Holi, we had a long celebration, a long weekend. So after long vacation, today is the first working day, and I'm back to the work, and I'm talking to you all guys. So these are the Holi pics. It's a festival of colors and basically change of season. So it's like one of the most popular and sort of festival in India. So we start with our lecture, commitment to learning. This is my first slide, and it doesn't matter how many resources you have. If you don't know how to use it, they are useless. So why I've placed this slide? Because I've noticed, like I just told, I started my rendezvous with laser in 2008-9, but that time hardly any dental course was there in dentistry in India. And I bought a laser company, sent me the packet, but they never offered me any course or any guiding or nothing about the laser. I just bought the machine. So for initial time, I still remember for almost 6 months to 1 year, it was packed in a box. I never used to take out and work because I had a laser. I wrote also laser dentistry, but I was hardly using it. Reason, I never knew what all I can do with the laser. So it took training, it took time, it took what you call experience, little bit of understanding of the laser, or understanding of laser physics and laser tissue interaction, that I got interested more and more, and then I started documenting. And then I just like after 2 year or so, when I become, I will not call myself expert, I'm still learning, but after some cases and all I did, I started lecturing, and I started my first lecture on the lasers, I remember, in 2011-12. I worked with KOL as a Dentsply, then Serona, then Light Medics, then BioLace. Many companies I've worked. So let's not talking. And currently, I'm associated with Woodpecker. So that's what I told. I mean, there is no point in buying a laser tool if you don't know how to use it. It is something like you buy a good digital SLR camera with a macro lens and ring flash, but you're taking pictures from your mobile phone. So you need to use the system what you have. So if you have a laser, you need to know how to use it, and you start integrating day-to-day practice. So we will be discussing this more into detail about next few slides. Right. So laser can be used in dentistry as adjunct to many routine procedure as well as in many case principal solution. Understand this. Laser, when I talk about laser dentistry, so laser is a cutting tool. Most of the people think it is a cutting tool for soft tissue, but it is not going to replace your scalpel. It can be used as an adjunct to scalpel. For cautery, yes, cautery you can throw. Cautery, there is no use now, and I don't recommend also anybody to use cautery or radio surgery and all those things. Those devices are obsolete. They cause lot of tissue trauma and all, and we will be discussing more about all these in my last webinar, practice management with the dental lasers. But right now, like, you need to understand that laser can be used in dentistry. So it is not only a cutting tool; it has application in almost all the stream. So where all we can use lasers in dentistry, we will be talking about that also. Also, why should we integrate lasers, right? So laser in dentistry, why? We all know as a dentist we are driven to change. Two main reasons why we change is first is a personal drive, and second is for the patient. Now when we say we change because of personal drive, I mean, I still remember, like, a life of as a dentistry is becoming more dentist friendly. See, simple example I'll tell. I'm an endodontist. So initially, the in this part of the world where I'm talking, in India, subcontinent, and all, the root canal preparation, biomechanical preparation, it used to call, now we call it cleaning and shaping procedure. It, like, when we were using hand files, so it was a step back technique. Now think about it. A step back technique means you need to use almost 15 to 20 tool hand files to prepare a molar. Whereas nowadays life is, you can use single file system like Wave 1 or something like that, and you can do a root canal system, root canal cleaning and shaping with just one file. So this is like the personal drive I told. I mean, we want to do better work. We want to do faster work. So that is why we are changing, and also technology we are adopting. And then we are changing also from the patient, because patient we have taken oath that we will provide best treatment to them. Also for the patient, because patients are also becoming demanding. Many time patient come to us and they have already done the googling, what you call, we call it googling. They have done the research work on Google, and they come and they say, doctor, I want this, doctor, I want that, I want this, and by this particular system, I want this by this particular laser, and all those things. So patients are also becoming demanding. Let's go, what are the patient's expectations from a dentist before going into further details. So we'll talk about patient's expectations first. So the first step in growing your practice is not just adding more patients, but being more productive personally with the patients you already have, and then add patients. So more productivity, what I mean by this is, like, we are doing a treatment and try to finish maximum treatment in one sitting, two sitting, and laser is one tool which helps most of the time to doing so. And then those patients gradually will bring more patient also, add more patient after giving your best treatment to the current patients you have already, right? So patient's expectations, the before going to this patient's expectation, just few interesting facts I want to share with you. Like, dentophobia, there is a terminology, you can Google it: dentophobia, dentist phobia, all those things. Basically, it's a fear of visiting to a dentist. And you need to understand what is a dentophobia. Basically, it is among the top 10 phobia in the world. There are patients, there are most of the patients who are scared of visiting to a dentist. Now they are scared of visiting to a dentist, you need to know why they are scared of visiting to a dentist. So simple reason, they think that dentistry is painful procedure. I hope I'm able to clear this for more. Like they think, the patients think that dentistry is painful procedure. It Whenever they'll come to a dentist, maybe dentist is going to inject them, there will be needle and all those things. So let me go through one by one slides, and then we'll go into more detail this process. So patient's expectations are, and when we want to talk to a patient about patient management, we will discuss more into detail. But patients, when patient comes to a dentist, they have expectations. Whatever treatment they are coming to us, it should be less invasive procedure, it should be precise, there should be less pain, healing should be faster, no bleeding, wow effect, and lesser number of patient recall. So these all, why I have put all these points here, because with the laser, with the diode laser, I can assure patient that the procedure will be less invasive, there will be less or no bleeding at all, it will be a painless procedure, healing will be better, no or lesser number of what you call patient visits, also lesser amount of medicines, because after when we work with the laser, there is hard chances of infections are also less. So these are because laser is a tool which I have already mentioned in my earlier slides, also earlier presentations also. Laser is a tool where hardly we need to inject. I mean, almost 80 to 90% treatment we can do without giving any anesthesia. And I will be sharing some videos today, later on, later part of my webinar, where we have worked on the patient without giving any anesthesia. Also, there will be less bleeding, it will be more precise, and I'll what I mean by lesser number of patient recall, I'll talk about this when I'm showing the clinical cases. And also, these are the patient expectations, and laser helps to achieve this. And then other advantages of laser are like I've just mentioned: minimal or no anesthetic painless dentistry, bloodless dentistry. They don't cause, if I'm using a soft tissue laser, they do not harm dental hard tissue. Their judicious use does not injure the dental pulp. Because of low or no heat production, they can be used around dental implant. This is very important. A diode laser can be used around implant, but a cautery cannot. They are antimicrobial, they remove endotoxins from the root surface. There is growing evidence that laser use may be positive therapy for periodontal disease. Also, laser technology is considered to be the state of the art by patients who are accepting of its use in their treatment of soft tissue surgery than the electrocautery. Right. So laser for all, we are talking for general dentistry. So where all we can use diode laser. Diode laser has got application in almost all stream of dentistry. Whether we talk about prosthodontics, we talk about pedodontics, we talk about periodontics, we talk about orthodontics, we talk about endodontics, so we talk about oral medicine. In all stream of dentistry, laser has got used, and laser can be used. And I will be trying to sum this in my slides, like when we will talk about application of laser in each stream of dentistry one by one. But before going into the detail, these are this slide I've taken is like almost 10-year-old, where these all these indications what are mentioned here are the indication which are FDA approved. So these are the treatment which are already FDA approved and which can be performed via diode lasers. So these are the applications which were published in year 2008 or 9. After that, almost 15 more indications have been used. And besides this, there are some off-label uses are there, which we will be discussing later on. Right. So I'm trying to sum up my webinar today. Some webinar in integrating laser for day-to-day practice and for a general dentist point of view. Now, most of the time, I mean, if you are specific, like you are doing only surgery, I would say you can go for, let's say, carbon dioxide laser, CO2 laser, or if you are a surgery you only want to perform, or if you want to perform only hard tissue procedure, you can go for, let's say, RBM or a CO2 laser. But then, as a general dentist, I recommend buying a diode laser, because it helps in getting perfection in most of the treatment routine dental procedure. So these are the some routine dental procedures I have mentioned here. The commonest procedure what we perform in the clinic are the oral prophylaxis, one of the most commonest. We do restorations, we do endodontic treatment, we do extractions, and we treat many times. We get patients who got hypersensitive tooth, and also prosthetic work. So common procedures are like in my practice, like I can tell, or I have like I'm lecturing since almost, like I told, 10 year, and more than 200 workshop we have done. So I interact with a lot of dentists. So most of these are the commonest procedures which we perform in the clinic. How I can integrate laser in these procedure, I want to talk about those in my next few slides. So let's go one by one. Clinical aspects. So first stream of dentistry is laser in oral medicine. I can use laser for diagnosis. I have already discussed in my first few webinars, so I'm not going into the detail. You can use curved diagonal laser for dopplermetric. Also, the other use of lasers in oral medicines are palliative treatment and low-level laser therapy. Let's talk about palliative treatment first. Palliative treatments are treatment for herpes and abscess and all those things. Also, laser can be used for hypersensitivity. So this is how, like, we do laser-assisted treatment of dentin hypersensitivity is a good method to solve immediate and long-term pain. Compared to conventional desensitizing topical agents, the laser treatment, although more expensive, leads to have get a rapid results with less application time and more quickly for the patient. I've got a video which is shared to me by one of my close friend and a very good author on textbook on the laser dentistry. So this is the video shared to me by Dr. Olivier Genovese. He's an Italian dentist, and he's using laser on exposed cervical portion of a tooth. And you need to notice that he's using near infrared laser. Means he can, for these type of treatment you can use 810, 940 or 980. And if you remember my last webinar, I will prefer using a 980 or 1064 wavelength, because depth of penetration for those two wavelengths are more. So a 980 wavelength would be preferred in these type of cases where patient is having sensitivity. And this you can see here, non-contact mode. Tips are non-initiated, and I go one by one. We have to go on each teeth. Adding dentifrice, something like gel cam or something like, can give added advantage. So you can always apply gel cam or something like that, or toothpaste or gel on the tooth prior to radiation by using a laser. So remember, non-infrared laser, near infrared laser like that is 980 or 1064 wavelength, and you need to go low level mode. So this is the treatment of hypersensitivity. Beside this, in oral medicine, I can do palliative treatment of abscess ulcer or herpes ulcer. Like, this is a case I want to share. This is an interesting case. Patient had a problem of recurrent ulcers. So recurrent ulcers means, like, these ulcers, whenever the patient comes to us, we treat these cases. Whatever treatment you do, conventional treatment I'm talking, whether you are applying topical steroid gels or painkiller, multivitamin and all, they take 4 to 5 days at least to heal. And second problem is, over a period of time, like let's say 2 month, 3 month, 4 month, they reoccur. So these are recurrent type of ulcers. With the laser, you can give chair side relief, and it takes just 5 minutes. The procedure is called as a laser application, laser bandage. We have made a video where I've used a woodpecker laser for the treatment of ulcer. Let's go to that video, and then we will share more detail about it. So basically, there are two steps. So you can perform this by LX16 or LX16 plus, whatever laser you have. Next step is, here I have used blue laser, 450 wavelength. Remember, very low watt, very low, because these are painful condition. So only 0.2 to zero point 0.4 watt. I go near to the since this is works in the non-contact mode. I go near to the ulcers, and if you are using a 980, then initiate at 0.2 to zero point 0.4 watt and gently scrub the laser, and you can just see the necrosis. So this is the immediate post-op, and if you notice, healing after a week. And the best part about treating these ulcers with the laser is the chances of recurrence is very rare, because somehow laser has got some effect on virus. If it is a viral treatment, viral ulcer, they have got some effect on the virus. So they never at that point where they used to reoccur, they never came back. I mean, this patient, I have a record. So I can tell about these patients. So this is like, how can I use or integrate lasers in oral medicine? Suppose I am doing surgeries also, so I can use soft tissue laser or diode laser in treatment of pigmented lesions. I can use for minor surgery, I can use for major surgery. If I have access to hard tissue laser, I can use even for removal of tori in impaction and all. But here, since we are talking about diode laser, so let us talk about some cases what we have done with the diode lasers. This is the case of varicose, and this is immediate post-op, you can see here. And when we're working now, one point you need to remember: when we are working in a high aesthetic zone like lip and area and all, chances of scarrings are there. So remember to always use lesser wattage than the routine. So like if I'm using a 980 watt diode laser here, I would prefer using zero point 0.8 to 1 watt only, not more than that, because otherwise there may be charring or scarring, which may cause later on issues. So use lesser power to achieve. And why I'm sharing the lower slide also, slight bleeding is there. Bleeding is most of the time, I mean, when we are working with the laser, we talk about bloodless surgery, but bleeding here, it was preferable because their healing was through primary intention, and that's how we achieve better aesthetic. So always when we are working in high aesthetic zone, try to maintain lower wattage or lesser wattage or to get the maximum result. So this is another case of leukoplakia, and we got it published also. Notice here. So there is a technique, since laser work better on pigmented lesion, and this is a white lesion. So there is a technique where we try to peel, and first we go, we note here, uh, slide E. We go all around the lesion, and then we try to gently elevate and peel the tissue. So this is how we treat leukoplakia. Another case I can show you here. Like this is how we go. We mark the area on the next slide. Once we mark the area, we try to elevate and peel off. And you can see here on the last slide, total removal. And here also, if you notice, very less power was used. And I've used here again woodpecker 980 watt here, woodpecker 980 watt laser to excise this particular lichen planus or leukoplakia, right? This is a case I want to show where I've used a blue laser for depigmentation. I mentioned last time also, the blue laser are the fabulous new laser, and I really like working with these lasers because they are the lasers which can work in the non-contact mode. So let us see this case of depigmentation, and then we will go more detail about it. So I want all of you to notice I'm working in non-contact mode, means I'm not touching the tissue. I'm keeping my tape little bit away, 0.5 to 1 millimeter away from the soft tissue. And then once ablation is done, take a wet gauze and just peel off the skin. So once this heals, it takes almost a week to heal. Once this is heals, the new gingiva will be much brighter, much pink in color, and like this you have to go wherever you need pink aesthetic. So this was immediate post-op. Healing after 15 days. You can see the difference in the color. Pre-op and post-op after a month healing. Also, in surgery, minor surgical procedure, we can treat fibroma. Like this case, I want to share video. This particular video. So whenever we are working, removing a benign lesion like this fibroma, you need to create a tension at the base, and then cut through the base. All around. Those who are using woodpecker laser, I've mentioned the power also what we have used, and in this case also I've not used any anesthesia at all. And you can see absolutely bloodless field. Pre-op and post-op. This is a case given to me by Dr. Damian. He is based in Poland, and there he has removed papilloma using a near infrared wavelength laser. Same way, you have to create a tension from the base and then cut from the base. And notice here also bloodless field. So, laser in prosthodontics. So, we have covered laser application in oral medicine. We have covered laser application in oral surgery. There are many uses, but I've just shared few videos and all to get an idea, because 1 hour is a very restricted time we have. So, we cannot discuss. And moreover, the work what we have done, it has taken hours of effort to produce all these results and all. So where all I can use lasers in prosthodontics? Now again, we can uh, broadly divide laser hard tissue uses and soft tissue uses. Hard tissue we are not going to discuss, so I'm not talking about crown prep and veneer prep and all. We'll talk about soft tissue applications. So one application which is very common is troughing as well as gingival modification prior to take an impression. So I can use laser for just prior to take impression. It is, if I say it replaces retraction cord, no, it cannot replace retraction cord. But since most of us are lazy, I would call myself, not all, but I am very lazy, and I don't like. I mean, for me, I think placing a retraction cord is the ultimate. But since it is little tricky and time taking, I prefer using laser to get a gingival modification or gingival what you call proper finished line. So how we do this? We go all around the sulcus. All around the sulcus. Remember, keeping the tip away, uninitiated tip, keeping the tip away from the hard tissue. Remember, we don't have to cut. We don't have to do gingivectomy. We have to just go all around the sulcus to get a result something like this: impression taking prior to crown lengthening. And you notice here, and then this is like what we do: lightly contract the sulcus lining just inside the crest of the gingiva while resting the side of fiber again tooth. Make short strokes, do not go circumferentially in one pass, actually incising the tissue, and keep fiber angle towards the soft tissue and not towards the tooth or implant. So this is the impression. Again, this case is by courtesy of Dr. Donald Cruzy, who is my mentor and guide. Just prior to impression, and just see the impression here. You can appreciate the finished line. I'm trying to move my arrow all around. You can appreciate how good is the finished line, and just without taking any without using any retraction cord for this case, right? So this is like one use prior to fixed processes. Also, I can use for modification of ridge, like in this particular case, again courtesy to one of my associate. uh, this was a flabby ridge and it was giving instability to the patient. So what you can do, you can use laser for modification, remove all that flabby part, wait for 2 weeks, and this is the result: a solid ridge which will give better retention. Another use of laser what we have done, and I'll try to share, if you are interested I can share the cases. You can do a vestibuloplasty in cases of severely resorbed lower ridges and all, where patients are not willing for implant supported denture and all, and you have to go for a denture. You can always modify the lower ridge by doing a vestibuloplasty on the buccal side. So you can do a vestibuloplasty and you can increase 2 to 3 millimeter ridge height by just modification of the ridge by doing a alveoloplasty. I've shared a case of localized vestibuloplasty here, but similarly you can do even for the generalized cases, and I'll share some cases of that in hopefully in my next few webinars and all. So right, so you can also use laser for post and core. Like this particular case, you can see hardly any ground structure was there. So what we did, occlusal view, we did a post and core, did the proper gingivectomy, and took an impression, and then this is the healing after a week, and then we placed the crown. So this is like, these type of cases are quite common when patient, like if they're not going for immediate prosthetic or immediate processes. So many times they come with the fractured teeth and all. So there, in those cases which used to be prior to I got my laser, they used to be hopeless for me and used to recommend extraction, either go for implant or go for a bridge and all. I'm doing nowadays lot of post and core we are doing by covering the tooth, by exposing the tooth root portions and all, right? So these are the cases like how we are using lasers for prosthodontics. So like application subject wise, we are talking lasers in oral medicines over, lasers in oral surgery over, laser in prosthodontics over. Laser in periodontics is again one of the, we can say, I mean, principally when I bought the laser, I was told the laser is actually to be used, supposed to be used in peri only, and DCI also made it mandatory for a very long period. Dental Council of India, they made it mandatory a laser to be in the department of periodontics. So primary, we were thought that lasers are for periodontist, like, but as I mentioned, I'm using laser for all procedures. So what about laser used in periodontics? So you can use laser for gingivectomy, gingivoplasty, gingival incision, excision, phrenectomy, phrenotomy, periodontitis, and periimplantitis. So I'll talk more in detail about the last two procedures, because other procedures are similar to somewhat we have done in laser surgery, in surgical procedures also. So more in detail about the periodontitis and periimplantitis. So there is a protocol known as laser for phase 1 periodontal therapy. Now, before going into the detail of this particular protocol, if you remember in my first webinar, we discussed about a company, Millennium Lasers, and they have made a laser called as Periolase. Periolase 7 is in the market right now. So this particular laser, Periolase, is an ND-YAG laser, and they have patented a protocol. This protocol is known as LANAP, Laser Assisted New Attachment Procedure, where they are treating severe periodontitis case, grade 2 to grade 3 mobility, with the laser help of the lasers, and they're getting excellent results. There are more than 30 PubMed articles are already published, and you can go through PubMed or on the Google, you get all the detail. So basic idea behind this is you need to understand what we are doing with the, like I just told, lasers are not a replacement tool for conventional therapy. I mean, lasers are not replacing scalpel. Lasers are also not replacing your uh, ultrasonic. But laser can be used and adjunct to ultrasonic to get a better result. So let us talk about this one by one. We think that laser is, if laser if we are doing a conventional scaling, whether I'm using a hand tool or a ultrasonic, do you think uh, just scaling is enough? Now remember, whenever I'm doing scaling, I am only cleaning the hard tissue part. See here, the calculus or plaque deposit. If my arrow is visible to you all, we are only treating the hard tissue part, crown part. What about the soft tissue lining, the pocket lining? We hardly treat it. The reason, because at the undergraduate level, the training is not sufficient enough. Even postgraduate training, the equipments what they we need to treat these cases and all are not provided most of the time. So you need to understand scaling is not enough. You need to treat the soft tissue also, the portion which is inflamed, and because of that only the gums have lost the because of that only gum has lost the attachment. So periodontal pocket, you need to treat the gingival portion, hard tissue, supragingival scaling, subgingival scaling, and then treatment of the soft tissue. So we are not debriding enough, we have already mentioned. So what is required here? See here, the soft tissue lining is still there. So the process, if you remember, if you can remember, in our BDS, we have been taught in apexisnal new attachment procedure. So that procedure, if you remember, they used to recommend that exercise, give a 45-degree beveling. I'm sorry, I think I've lost. Yeah, give a 45-degree beveling to the sulcus area so that you remove all the granulation tissue, and through that it can. And once we have done the proper debridement of hard tissue, we can get attachment. So how we work? We take help of the laser here. You can see in this case. So before that, there are numerous, like I've just already mentioned, there are numerous research and clinical case studies that show how certain lasers adjunctively used with the scaling and root planning can improve the effectiveness of periodontal therapy. So basically, laser energy, when we are using laser also we have to use in the two part. So two part means one, we will be using laser to eliminate the pocket lining, and second, to sterile the pocket, or you can say the disinfect the pocket. So the concept is laser energy eliminates bacteria embedded in the tissue within its range of contact and absorption. Also, the same laser we are using to remove the pocket lining. Next, we want to talk about periimplantitis. Now, what is periimplantitis? Periimplantitis is, again, it's the same thing, same disease, something like periodontitis, but it affects the implant portion. Now, why we want to discuss about periimplantitis here? Because periimplantitis only, I know, as far as I know, only 3 or 4 protocols are there for. I'm not a basically a expert of implants, and I do only very. I have a very basic knowledge of implants, so I cannot discuss more detail about the implant procedure. But of course, I have treated few periimplantitis cases, and I've used different protocol. So when I'm using all these protocol where I've used lasers, so. I've got good results, and I can tell you what are the different protocols we have used. So to treat periimplantitis, there are 4 protocol I know. One is PAD. PAD is photoactivated disinfection. In photoactivated disinfection, we inject a particular dye. You need to it can be toluene blue or anything, or fustian, basic fustian and all. The you need to inject those dyes into the pockets all around the implant area. Also, pad can be used even in the periodontitis also. So you need to inject those dyes into the pocket, or a periodontal pocket, or periimplantitis pocket, and then you have to use a specific light. They can be laser light, or they can be LED lights also, and those lights activate those dyes. Those dyes, they get affiliated to bacteria, and when we use those lights, they kill the bacteria. So that is the one procedure, one protocol. You can use pad. Second protocol is using, by the way, conventional ultrasonics are not supposed to be used. So the next thing you can use are the tough tips, Teflon tips. So Teflon tips are tips which, again, these tips what I'm showing you here, these are the my cases. These tips are provided to me by Woodpecker only, and these are available with Woodpecker, and you can contact IDS India. So you can use these tips for cleaning. Like I just mentioned, conventional ultrasonic tips are not supposed to be used because they interfere with the osteointegration, and they can cause instead of they can also accelerate the process of failing implant. So you can use second processes, you can use these type of tips. Third protocols are microbrush. I have not used, so I cannot tell you more detail. These what I know, they are the microbrush available with certain companies. You use those brushes. I mean, they are used. They are supposed to be used in your micromotor, and then you take into the sulcus all around the implant. So you can use those. They clean the implant surface as well as they clean the soft tissue portion also. So they are also one. Protocol which was supposed to be used. So but since I have not used, I cannot talk more into detail. I've used pad, I've used tips, Teflon tips. The last protocol is lasers. Same way as I've just mentioned, you can use laser for periodontitis. Same way you can use for treatment of peri-implantitis. How? Again, two steps. First, you have to use these Teflon, the tips I just showed you. You have to use these Teflon tips, and then once these Teflon tips you have used, cleaning have been done, then you can use laser first part by removing the periodontal lining, and second, you can use by steriling the pockets all around. So this is how you can do treat peri-implantitis also. So like this is the one more aspect in periodontitis, and we will be talking more in detail in my next webinar, uh, relation of peri-implantitis with the practice management also, right? So like I just mentioned, vestibuloplasty is the one case you can do. Like this particular case, if you see, patient has localized loss of soft tissues, uh, lower anteriors, and she was very particular. She was getting scaling done. So eyes can't see what brain doesn't know. We were doing the scaling for like almost 4 5 times we have done, but they used to reoccur. But before introduction to laser, and I recommend all of you to go, those who are who are working with a periodontist, they can take their help also. I also recommend to all of you to go and discuss with your periodontist friend. They will tell you to do a test called as freenum test, where they tell you how to check whether freenum is high attached or low attached and all those things. So basically, they check the tension. So I attended one of the lecture of my friend, and then I came to know what is particular test, freedom test and freedom tension test and all. So once I knew this, I came back and I performed vestibuloplasty in this particular case. You can see here again another picture. This is how we did the vestibuloplasty. We did the scaling, and then I have used 940 wavelength diode laser here. I made sure that I'm removing, or I'm doing the vestibuloplasty till I can see there is hardly any tension. Once I was sure there is no tension remaining, so this is again I'm doing the test and applying topical anesthesia only, topical gel, and little bit more modification was needed. So we did this same, and this is like exactly, if you can see here also, hardly any tissue tension. Total tension was removed, and vestibuloplasty was done. This is the healing after, sorry for the bad quality of picture, healing after 10 days. So like this is the another case. I can also use laser in pediatric dentistry. Pediatric dentistry, there are many aspects. Many times I've used laser for help in erupting teeth, like the teeth which were not coming out. I've used laser for eruption. So exposure of unerupted teeth, phrenectomy, phrenotomy, pulp capping, pulpotomy, and pulpectomy. Few cases I can share with you, some X-rays and all. And I want to share in restorative dentistry where I've done pulp capping also using a laser with the help. So this is the case which I want you to see. This was like I was doing a class 2 cavity, and it got exposed. So I use laser in two way. First, in the non-contact mode to achieve coagulation or hemostasis, we call it. Once bleeding was controlled, gently at a very low power, I went all around the exposed portion to do the disinfection. Even though I had placed rubber dam, but somehow I wanted to see the effect of laser radiation for the disinfection purpose. So once we got this is done, placed a dical, top with resin modified glass ionomer cement, followed by composite restoration. So this is like a pulp capping we have done, direct pulp capping. Orthodontist. So now again, we are not going for hard tissue applications. We will be talking about soft tissue applications only, where all I can use. So we were talking lesser number of patient recall. So lesser number of patient recall. I want to sum up with this particular case, where the patients had brackets on all the teeth, but not on the canine. Canine demanded exposure. So when our teeth demanded exposure with the, if I'm going through the conventional technique or conventional method, I would have done with the gingivectomy knife or by scalpel. But to control bleeding and to get a healing, I would have it would have taken 2 3 days. So patient had to, but obviously patient had to come again. So with the laser advantages, since there is no bleeding at all, the same sitting we have done the exposure of canine as well as we have done placement of the bracket also. So lesser number of recall, like patient saved one appointment, even I saved the time. Uh, Remember, it is always better to do most of the procedure in lesser number of recall. So this is like one case I am showing. I'll show more cases, some little bit tricky and tough cases also. I want you to see which we have done. So like this case is another case, exposure of canine. This is a tricky case where impacted palatal placed canine was there, where we have placed the bracket in the same sitting. You can see hardly any tooth was exposed, anything was exposed. So we went on digging. We had to take a CBCT to locate, because since palatal portion is very hard, so when you try to palpate, it can give false reading also. So we went on doing, we got a CBCT done. We located exactly, took an X-ray, occlusal radiograph, and then exposed the area. And we placed the bracket, and same sitting we placed the bracket also. Another case, impacted lower mandibular. This case again, a tricky case, came to us, and same you can see here. We located where is the canine, and then we exposed the area, and you can see here when tooth was exposed, we placed the bracket, same sitting, like this, something like this. So this is how we are using in the cases of uh, impacted canines and impacted tooths and all those cases. Also, we are doing a lot of frenectomy and other treatment procedures. Let me show you those also. Like this case is a particular case. The patient wanted aligners, so we took a. I'm sorry for the poor quality of photographs, but these pictures are basically what patient shared with us prior to the treatment. So she shared these pictures to us, and then we recommended, and we went for a proper case after studies and all, and then it was required to do a frenectomy. So this is the, again, this is the clinical view, her cases, and this is what we did. The Here I've used a 450 nanometer wavelength laser, and this is a case is done very recently by us, and this is the first time I'm showing this case to any platform. Frenectomy using a 450 nanometer wavelength. I've not used any anesthesia. Non-contact mode. This is immediate post-op, and we checked it again. Aligner was fitting properly, and I've got a photo. Sorry for the poor quality. This is healing after 15 days. But patient was having some little bit of issue with the placement of aligner also. But here after that, she is relieved, and we are in touch. She's from UAE, so we are waiting for her to come back to Lucknow and visit us so that we can take a better picture. So this is like just healing after 15 days or so. So laser in oral pathology, where I can take a biopsy sample. See here, I can take a biopsy sample with the help of a laser. Remember to, whenever we are giving the sample, mention that that sample has been taken by laser. So let them interpret it away from the excision site, because at the site of excision, there may be charring, there may be necrose tissue which can give false interpretation. So always mention, and a little bit more I want to add here. Like I worked in an institute where I worked with department of oral pathology, and we have done almost 15 cases of the laser excision and compared with the normal excision, and we've got decent result with the biopsy taken, sample taken by lasers also. So I can vouch for it. Like you can do always a biopsy with the help of laser. Just remember, use lesser power so that the tissue shrinkage of tissue is not there, right? Also, I've worked with the community dentistry in institute, and where we have treated a lot of oral submucous fibrosis tissues cases, oral submucous fibrosis cases. Those who are in abroad, if anyone is from Europe or Western countries have joined, they may not understand this disease, but this disease basically due to excessive use of betel nut, and because of this, the soft tissue get fibrosed and the mouth opening becomes limited. So we have treated many cases. I have also guided one thesis, almost 100, more than 150 cases data we have, and we have got decent result when we have used fibrotomy using dental lasers. I can show a small video also. These are the post-op healing after 6 months, and this is a small video how tough the case was and how we have used for cutting. Hardly one finger was going inside. Right. So conservative dentistry. This video is by Maurizio Signoni. He's a good friend, mentor, expert in microdentistry, where he's using laser for disinfection of dentinal caries. Where you have a doubt whether this is the remaining caries are infected or affected, you can always use laser for disinfection. Also, in many cases, like direct pulp capping, I've already told, many cases of the proximal caries, there are growth of gingiva. So you can always use laser to remove those overgrown gingiva or pulp polyp or gingival polyp and all, and remove, sorry, pulp polyps, gingival polyps, and you can remove, and you can do the same setting restoration. This I've already shown. So endodontics use also. It's sorry. Okay. Laser in endodontics, we have already discussed in my last webinar, but again, I can use it for pulp capping, pulpotomy, cleaning, and disinfection. I've made a video which is most common questions I've been asked, like how to use laser for disinfection of the canal. So proper protocol, I've made it here. Let us see this video, and then we will talk more in detail. So there are two ways to do laser disinfection. You can use it in dry canal or you can use in wet canal. Remember, if it is a dry canal, you have to go 1 millimeter short of the working length. If it is a wet canal, 5 millimeter lesser than working length. This is the motion you are supposed to use. And if you have attended my last webinar, always prefer infrared 980 wavelength or 1064 nanometer wavelength, because they have got deeper penetration, depth of penetration. So they are always better compared to near infrared wavelength. So this is the protocol. how you are supposed to use circular motion up and down. And let me go through the clinical protocol. Like I told, locate the canal, prepare the glide path, a good irrigation, and then, like I mentioned, I prefer single file system. So here I'm using wave 1. Once preparation is done, irrigate nicely, first with the hypo, then with the liquid EDTA. Flush the canal with liquid EDTA. That should be the final rinse. And then you can, if you want to go for wet canal, use the hypochlorite. Sorry, my slide got changed. So either you can use hypochlorite, and this is how you are supposed to use laser, or even plain saline. But I prefer using hypochlorite. Circular motion up and down, 5 millimeters short of the working length. Okay, so this is like the endodontics. I told I'm using laser many times as an adjunct also. So many times patient come up with the swelling, and when there is a swelling, localized swelling, you need to do stab incision to remove this. So instead of doing a stab incision with a scalpel, I have used laser in a few of cases. Let me share those cases also. You can notice here. Since in presence of abscess, injection doesn't work. So scalpel can be tricky and can be very painful. So laser, when you know how to use it, so you can always give a blunt dissection with the laser and try to break all the loculi and drain the abscess. So this is like the one case. I've compiled few cases. And make sure all the abscess is drained. Another case. Just a puncture, and you can see. And trust me, the patient, when patient comes in this type of situation, they are having pain, and as you puncture, the tension is relieved, the tissue tension is relieved, they get immediate relief. For a second they feel pain, but just for after a few seconds, like few minutes and all, they're really comfortable. And another case we have done like that. So this is like uses of laser for abscess. You can also use laser for control of bleeding, post extraction, for coagulation. If I have a video, okay, remember, to achieve coagulation, the tissue needs only to be at 60 degrees. So sometime it is needed continuous wave mode. Let me show you the video, as we are running short of time now. This will be my last video. So basically, if you heat the blood at 60 degree, you can see the coagulation. So I'm using at 1 watt. little bit more far than the surgical site, and you can see here already coagulation, right? So this is how we achieve coagulation. I have more videos and I would love to share. So those who want can always contact me on the uh, Facebook or page of Woodpecker page or directly to me. So this is like the periodontal treatment. So conclusion, the advantage you have yesterday will be replaced by the trend tomorrow. You don't have to do anything wrong as long as your competitor catch the wave and do it right. You can lose out and fail. So always keep yourself updated, upgraded. Uh, the process is learning, unlearning, relearning. So that goes on throughout the life. Like I just mentioned, rarely in dentistry does a clinical tool emerge with so many possibilities for treatment. So laser is the one tool which I've tried to mention few possibilities only, but laser is the one tool which has got application in all streams, many possibilities. Like I've shortage of the time, so I have not able to cover some more. Like there are some interesting treatment protocol for TMJ problem, for Bell's palsy and all. We have treated and we have got decent result. And I would love to share those also whenever we get time next. So we have written a book, laser. We have contributed a chapter in this book. A lot of procedures are given in this book. First chapter is written by me and my wife, Dr. Shally, and Dr. Donald Colusi. Uh, excuse me, sorry. So laser in dentistry, where to begin? So this is my Facebook page, this is my email. Thank you everyone for watching me. I'm open for question answer session, so let me stop sharing, and those whatever questions we have, we would love to answer if we have any. Thank you very much again.